One of the most important questions in drug therapy is, what drug to give the patient? Well, the patient's drugs are all here. But what you're looking at is not really the drug, but the dosage form. For example, this dosage form is a tablet, and this is a mixture. A dosage form is the physical form of a drug in which measurable doses can be given. How many do you know of? I'm William Lim. Join me in this video lecture on dosage forms for medical students.
We'll begin with oral dosage forms. That means it is intended for administration through the mouth. And these are the types of solid and liquid dosage forms we will consider. We will look at three types of solid dosage forms and start off with the tablet, which is drug in powder form compressed. We will consider these 6 ways in which a tablet can be modified.
These are all tablets. And here's a typical tablet with a line in the middle. That's a scored tablet that lets you break it into 2 along the scoring line. And these are sublingual tablets. How do you use it?
Now, a sublingual tablet is administered by placing it under the tongue, as being shown in the video. This type of tablet is used to relieve the pain of angina where a rapid onset of action is needed. When an ordinary tablet is swallowed, time is needed for it to dissolve in the stomach, get absorbed in the small intestine, get metabolized in the liver before the heart pumps it to all parts of the body. But with a sublingual tablet, as it dissolves under the tongue, the drug enters the bloodstream directly through the blood vessels at the oral mucosa to give a rapid onset of action.
A chewable tablet is intended for chewing before swallowing. This is useful for children and others who cannot swallow a large tablet. An effervescent or soluble or dispersible tablet must be dissolved in water before swallowing. So when it's dissolved, absorption is faster because the drug is in solution. So you need to dissolve it first before you drink the liquid. Now imagine what happens if you swallow this tablet. Lozenges are meant to be sucked in the mouth. You can tell by the size and shape that it's not meant to be swallowed. So the drug is intended to medicate the mouth and the throat. Now this tablet is specified as CR, which means controlled release.
An ordinary tablet breaks up in the stomach and subsequently all the drug is absorbed at once. A controlled or slow, sustained, extended or modified release tablet breaks up slowly. And so the drug level in the blood rises slowly and remains sustained for a longer period. One way this can happen is when the drug is dispersed in a polymer matrix, and as the matrix dissolves, the drug is released. For this type of tablet, the patient has to be instructed to swallow the tablet whole without chewing.
This tablet states enteric coated. What is that?
The enteric coat prevents the tablet from dissolving in the acidic environment of the stomach. It only dissolves in the less acidic environment of the small intestine. This is useful to protect the drug from degradation by acid or to protect the stomach mucosa from the drug. Once again, the patient has to swallow the tablet whole so as not to break the coating.
The tablet is a very common dose form because it has many advantages. Among these are that it is portable, easy to carry, it's palatable, you can swallow it very quickly, There's precision of dose because every tablet is approximately the same amount of drug. And the expiry date is fairly long because it's fairly stable. And you can manufacture this on a large scale so it keeps the cost down. Now we turn to the second solid oral dose form, which is the capsule. We're all familiar with the two-part hard capsule. The drug is in the powder form and is enclosed in a gelatin shell. Whereas these are soft gelatin capsules. So the advantages is that it allows the drug inside to be in different forms such as liquid, semi-solid or gel. The advantages of the capsule includes being portable, and you can carry it around, and it's palatable, right? You can swallow it quickly. It's easy to swallow, easier than a tablet. And you can identify it easily because of different colors and wordings. And the gelatin shell allows the very easy release of the drug. Disadvantage of the capsule includes being more expensive to manufacture, and you have to keep it in a cool and dry place. And now the last solid oral dosage form is the pill. Now people often use the word pill for tablet, like when they say slimming pill, birth control pill, sleeping pill, and so on. But in actual fact, a pill is a hard, round, spherical mass of material bound together with binders. Here's an example of pills. Okay? And you can see that it is round, it is hard, and it is spherical, right? And so it's hard, and so it can be harder to dissolve, a pill.
Now we go to liquid oral dose forms. A mixture is the most common. This is an oral liquid containing one or more active ingredients dissolved, suspended, or dispersed in a suitable vehicle. Aside from the drug, various other agents can be added. We are going to consider the oral solution, suspension, emulsion, drops, and linctors.
An oral solution is a clear liquid preparation containing drug particles dissolved in a suitable base, whereas a suspension consists of drug particles which are not dissolved but suspended in a suitable vehicle. Eventually, the particles sediment, but on shaking, they can be redispersed long enough for pouring out a dose. An emulsion is a mixture of two immiscible liquids like oil and water, where the droplets of one are dispersed into the other and they remain dispersed by adding an emulsifying agent. An oral emulsion is usually oil dispersed in water. An example is cod liver oil, which has a bad taste. So by making an oil in water emulsion, the taste is improved and it is less oily. For both emulsion and suspension, the bottle must be shaken before pouring out the dose. Drops are drugs in liquid form which are concentrated so that you only need a few drops per dose. And this is often for dosing patients who cannot or will not swallow a larger volume. A linctus is a viscous oral liquid containing drug particles that is dissolved in a suitable base and has a high concentration of sugar. It is commonly taken for cough, where in addition to the drug, it gives a demulcent or soothing effect by coating the throat. So it is swallowed slowly without water. Now, if you compare liquid and solid dose forms, what are the advantages of the liquid dose form? Obviously, a liquid is easier to swallow compared to the solid, and that's advantageous for children. And it can be formulated in different colors and with different flavors. And drugs in solution are also absorbed faster. But there's also disadvantages. Like, for example, it is less portable, right? It's harder to carry. And you need to pour out a dose, which means that every dose can have a slightly different volume, different amount, right? And drugs are less stable in solution. And then after some time, there may be microbial contamination.
Right now, from oral, we will move on to parenteral dose forms. Enteral means through the gastrointestinal tract, and so parenteral means not by the gastrointestinal tract, such as by injection. Anything injected has to be sterile and particle-free. What are some reasons to inject a drug? Patient could be unconscious or uncooperative, when oral formulations is not possible, example insulin, or when we need a rapid effect or we need high levels in the blood. We will now consider 3 common parenteral routes. Firstly, IV. The intravenous route is injection into a vein where the onset is the most rapid. It can be a bolus injection or a continuous infusion where the drug is diluted into a solution that is isotonic with blood. IM, intramuscular. This is used when the drug is injected into muscle tissue for a slower onset. SC or subcutaneous. Injection is a small volume injected into the subcutaneous layer for slow absorption of the drug.
Diabetics receive insulin by subcutaneous injection using a syringe like this in the hospital, and they inject insulin at home using an injector like this. Here are some video clips to show how it's done.
When you're ready to inject, pull the plunger back to the number of units needed, drawing air into the syringe. Insert the needle into the bottle of the insulin through the rubber cap. Inject the air from the syringe into the bottle. Turn the bottle upside down with the needle in it. Make sure the tip of the needle is fully submerged in the insulin as you pull the plunger back. Next, inject at a 90-degree angle. Hold for 5 seconds, then pull the needle out.
Droplet pen needles. Instruction for use. Before injection, always remember to attach a new needle. Carefully remove the seal from the pen needle. Push the pen needle onto the pen and twist until it is tightly attached to the pen. Remember to push it straight on the pen, never at an angle. Remove the outer protective cap from the needle and put it to the side. You will use the protective cap again to remove the pen needle from the pen. Remove the inner protective cap. To check insulin flow, select 2 units and press the dose button until you see a drop of insulin on the needle tip. Repeat if insulin does not appear. Select the right dose of insulin to inject, recommended by your healthcare professional. Make the injection as directed by your healthcare professional. Push the dose button down completely and count slowly to 10. Then remove the needle. After the injection, carefully replace the outer protective cap to the pen needle. Remove the pen needle from the pen after each injection to prevent air from entering the cartridge and insulin from leaking out. Dispose of the pen needle to the sharps container. Droplet pen needles are single use only and should be disposed safely.
And now we'll look at dose forms for specific cavities in the body. And we'll start off with dose forms applied to the eye. The first one is eye drops, which are sterile solutions for administration into the eye for treatment of conditions like dry eyes, infection, or glaucoma. Once opened, the bottle must be discarded after 1 month. An eye ointment can be applied to the eyelid or inside the eye to give a longer effect than eye drops. For the ear, ear drops are liquid medications to be dropped into the ears, such as antibiotics, dissolving earwax, and other purposes. Nasal drops or nasal spray are usually for administering drugs for local action at the nasal passages, such as for nasal congestion. And then a mouthwash for the mouth or gargle for the throat are not to be swallowed. They are usually used for infection or pain or inflammation in the mouth and the throat. Next, drugs for the lung. A pharmaceutical aerosol is a dose form where the drug is mixed with a liquid propellant in a pressurized container, and when the button is pressed, the drug is released as a spray of fine particles suspended in gas. This is often used to administer drugs to the lungs, such as for asthma. The most common is this metered dose inhaler. To deliver the drugs into the lungs, the patient has to exhale, then press the metal container once to spray the aerosol into the mouth and inhale at the same time so that the aerosol goes down the airway. Then close the mouth and hold the breath for 5 to 10 seconds to allow the drug to deposit at the lungs. Then exhale slowly through the nose, like this. Shake the bottle. Exhale. Five to 10 seconds. Then exhale slowly. And then wait for about 30 seconds before giving the next dose. If you attach a spacer to the inhaler, then most of the bigger particles that is sprayed out will remain in the spacer so that the smaller aerosol can be inhaled. And these are the ones that will go down to the lung. Another type of inhaler is called a dry powder inhaler, where the drug is in powder form. Prior to use, the drug stored in a capsule or blister inside is punctured by pressing the lever until the click is heard. This gets the drug ready to be released. It is breath actuated, meaning the dose comes out only when you inhale. So, at first, you slide the lever, exhale, five to 10 seconds holding the breath, then slowly exhale. The next cavity is the rectum. A suppository is for insertion into the anal canal. It is a semi-solid with a bullet shape. It will melt at body temperature to release the medication, which can be for local effect at the rectal mucosa or for systemic absorption. Next is an enema. An enema is a liquid introduced into the rectum. It's commonly used to promote bowel movement before a medical procedure that requires the colon to be empty. For this type of enema, the tip is inserted into the anal canal and then the container is squeezed to push the liquid into the rectum. Lastly, for the vagina, a pessary or vagina tablet is for insertion into the vagina where it will dissolve and the medication is released. The most common use is for antifungal treatment. It can come with an applicator like this, where the pessary is placed into the applicator inserted into the vagina, then the plunger is pushed to release the pessary into the vagina. Finally, we move on to topical dosage forms. Topical means pertaining to a particular surface area, so topical dose forms are those applied to a certain area of the skin. We'll start off with the cream. Cream is a semi-solid emulsion formulation for application to the skin. Next is a gel. Gel is a transparent or translucent semi-solid preparation that liquefies upon contact with skin. So common drugs in gel and cream includes anti-inflammatory, antiseptic, and others. Next is an ointment. An ointment is a semi-solid preparation in a stiff base. It is greasy, emollient, that means it softens the skin, and occlusive, that means it increases the skin moisture by reducing water loss and increases drug absorption. Next is a lotion. A lotion is a liquid preparation which gives cooling effects to the skin by evaporation of solvents. Example here is calamine lotion, which you probably know is used to treat skin irritation and itching. It's a suspension, so you need to shake the bottle before using. And then a liniment is a liquid or semi-liquid applied to the skin by rubbing. It usually contains a rubefacient, such as methyl salicylate, and that will dilate the capillaries of the skin, so the skin is irritated, red, and feels warm. These sensations interrupt the pain signals from the underlying muscles or pain or joint. So this is called a counter-irritant effect, and it can help to reduce musculoskeletal pain. And finally, transdermal patch is an adhesive patch that delivers drugs at a constant rate through the skin into the bloodstream. So drugs that's available as transdermal patch includes painkillers and nicotine for smoking cessation. A common one used by many is a medicated plaster for pain. So it gives the sensation of warmth or cold, which is a counter-irritant effect to stop the pain sensation from the underlying muscles or joints.
When it's time for my drug, I see it, I touch it, but it's not the drug I'm holding. I'm holding the dose form containing the drug that I need to be administering. Topical, parenteral, oral, and